My name is Haiti V. Lindsay, and I will be talking about the need of an education and prevention intervention, and on the huge problem soil transmitted helminthis really is. As Michaela stated, we will be implementing a how to stop the spread of soil transmitted helminthis through educating adults and children in villages on first how and why it is spread, and second, what they can do to prevent soil transmitted helminthis through proper hygiene. Soil transmitted helminthis in Uganda is reported based on a data for 20 to 185 school children from 271 schools. The overall prevalence of Ascarosus, lumbersodius, trichuria, and hookworm was 6.3%. 5.0% and 43.5% respectively. The prevalence of a lumbricoides and T. trichuria was unevenly distributed in the country, with prevalence greatest in southwestern Uganda, whereas hookworm was generally more homogeneously disturbed. Based on preliminary costs analysis of an ongoing school-based control program, the financial delivery cost per school child treated with albendazole is estimated to be between US dollar 0.4 and 0.8 in different districts. This is by publicmed.com. As we can see, the spread of soil transmitted helminthis seems to be on the rise, where there are organizations like WHO that do combat it after an individual has it, and deworming comes in form. WHO and their treatment programs, as Michaela expressed. However, we do want to help combat it before children and families are infected, so that they do not have to go through deworming, medications, and so on. Soil-transmitted helminth infection is found mainly in areas with warm and moist climates, where sanitation and hygiene are poor, including in temperate zones during warmer months. These STHs are considered neglected tropical diseases and TDs because they inflict tremendous disability and suffering, yet can be controlled or eliminated. Through the CDC, I read that infections caused by soil-transmitted helminthis are chronic and disabling amongst children and families. They include roundworm, whipworm, and hookworm. These parasites deprive the human body of vital nutrients like vitamin A and iron and weaken the immune system of young children during crucial stages of growth. Infected children often suffer with painful symptoms such as swollen stomachs, diarrhea, and inflamed intestines, keeping them from attending school. These worms are affecting more than 1.5 billion people based on estimates by the World Health Organization. Soil-transmitted helminthis live in the intestine, and their eggs are passed in the feces of infected persons. If an infected person defecates outside near bushes in a garden or field, or if the feces of an infected person are used as fertilizer, eggs are disposed on soil. Ascaris and hookworm eggs become infective as they mature in soil. People are infected with Ascaris and whipworm when eggs are ingested. They can happen when hands or fingers that have contaminated dirt on them are put in the mouth by consuming vegetables and fruits that have not been carefully cooked, washed, or peeled. Hookworm eggs are not ineffective. They hatch in soil, releasing larvae, immature worms, that mature into a form that can penetrate the skin of humans. Hookworm infection is transmitted primarily by walking barefoot or on contaminated soil. One kind of hookworm, Ancylostoma dondinale, not sure if I said that correctly, can also be transmitted through the ingestion of larvae. And this is all from the information and stuff I have gathered from the Center of CDC. As we can see, this is a huge issue that can be addressed and possibly stopped before it starts through proper hygiene, better water sources, and better ways of finding or building specific places outside away from good drinking water for defecation. However, our focus will be on proper hygiene through the proper way of washing of the hands, as stated before. Before rolling with the intervention and implementing it, we would meet up with the Ministry of Health and explain our hygiene and sanitation intervention we have created. Then we would ask them if we could be considered to work with them in the Uganda Sanitation Fund program, which is an ongoing program that has started. The Uganda Sanitation Fund, USF, is a program through which financial support grants from the Global Sanitation Fund, GSF, is provided. It is a 5-year-long program funded by the Water Supply and Sanitation Collaborative Council, WSSCC, managed by United Nations Office for Project Services, UNOPS. This program aims at creating a robust demand for sanitation to the point that people seek out creative ways to install toilets in their communities and stop open defecation. The purpose of USF is increasing development and utilization of sanitation and hygiene facilities with the goal of contributing to reduction of morbidity and mortality rates due to sanitation-related disease among the people in the Program E area. A key result area is stopping open defecation throughout the Program E area, Ministry of Health, Republic of Uganda. With this program, we can get the backing we need to provide clean water and bathroom type ordeal, so that in this form we can educate individuals in Uganda. Even if our intervention doesn't cost anything, individuals on this behalf can have access to those things that they will need so that education that they acquire through us can help them in the prevention of getting soil-transmitted helminths. Because this is an intervention that is ongoing, we can help make it better through our knowledge we have gained and teach and educate individuals to spread awareness and prevent the problem from further spreading. With working with Ministry of Health, we can make a bigger and long-lasting difference. We can also work with the Ministry of Education and work with the educators along with individuals of the village, so when we are gone, this can continue to flourish. Also, people from the villages will be more encouraged to learn and get educated on the prevention methods if they see that even the teachers teaching their children are involved. We would also outreach and include the Uganda Village Project. They have been running since 2003 to promote public health and sustainable development in the rural communities of the marginalized district in Southwest Africa. Or Southeast Africa, I'm sorry about that. We believe they would be a good to work with along with the Ministry of Health for the backing of better water and bathrooms for the village. Ministry of Education to include local educators to continue on with this intervention when we are gone, and the Uganda Village Project to help them further spread awareness and education. With working with these three, we can become a fantastic four and make that big change come about in stopping soil-transmitted helminths through our intervention.